Despite all the progress we've made in vaccinating our community over this past year, we're still seeing individuals who become seriously ill and die from COVID because they don't have any immunity to protect them that vaccination could provide. Today, we're caring for about 240 COVID-19 patients across our system and we've seen a steady increase since Thanksgiving, a time when people were gathering and traveling, and that's resulted in some spread of infection. The majority of the patients in the hospital with COVID are unvaccinated, and that's been very consistent for some time. And nearly every patient, in fact, all but one patient on a ventilator in our system is currently unvaccinated. Those who are vaccinated and require hospitalization are typically in their 70s with one or more different medical problems or comorbid conditions, and they often receive their last vaccination more than 6 months ago, meaning they have not received a booster. Moving to Omicron, which I'm sure a lot of people have questions about. We know that that variant, the Omicron variant, is present in our communities and rapidly spreading. You may have seen this morning, now makes up 73% of new cases in the United States. And according to the CDC's website, over 90% of new cases in the Southeast, of which North Carolina is included in that region, are now Omicron. We know that Omicron is 2 to 3 times more contagious than the Delta variant and 4 to 6 times more contagious than the original strains of COVID that emerged almost 2 years ago now. In general, a person who has Omicron variant will infect 3 to 5 people around them, which makes for the rapid spread of the virus, been an incredibly quick movement of this variant. It also appears to potentially have a shorter incubation period, which means perhaps as short as 3 days, making people contagious more quickly after they get it, leaving a smaller window for someone to discover they have it and get tested. So there's some talk anecdotally that clinical disease from Omicron may be less severe, but we don't know that definitively just yet, and it still will remain a threat to anyone who does not have immunity from vaccination or a combination of vaccination and previous infection. Individuals who have not been vaccinated will be at the highest risk of severe cases of COVID with this variant, as has been the case with other variants, including complications like hospitalization and death. So we anticipate over the next 6 to 8 weeks, we will see significant increases in the number of cases in our community, and that will include some breakthrough infections in vaccinated individuals, particularly those who've not had a 3rd dose of an mRNA vaccine or a 2nd dose of following Johnson & Johnson vaccine administration. For many vaccinated individuals, these breakthrough cases are expected to be mild, but for those who are unvaccinated or older or have other comorbidities, the cases may be more serious. Because of the high numbers of still unvaccinated people in our communities, this raises the prospect of another difficult January for our local hospitals, and we're preparing and bracing for that possibility.